I'm Winnie Akinyi. I'm a fascia manipulation provider at the Human Garage. The fascia is an integrated, continuous connective tissue that wraps and interconnects your muscles, your organs, your nerves, your blood vessels, and everything in your body to make your body a one interconnected system that functions in unison. The most common pattern that I've seen in most of the patients is back pain. I think back pain is a major concern for majority of the population. I wouldn't miss a case with it on a single day, every day, most probably up to 5. So it's a common pattern. Mostly by taking a clinical history, a detailed clinical history from the patient. Then from the patient's history, you can be able to create a timeline. And from this timeline, we usually are able to create an hypothesis that leads us to determine a specific segment that we can pick for the palpation. And then from the palpation, we can determine which areas of the body to treat. I can categorize the conditions mostly because we usually see arrays of conditions. From musculoskeletal presentation, this would be common issues like the back pain, the knee pain, neck pain, shoulder pain, such issues, mostly from the musculoskeletal point of view. Then there is the internal dysfunction, and in most cases, this internal dysfunction usually also accompany the musculoskeletal pain. So they usually have a similar presentation. And in this case, you find people have chronic constipation, chronic acidity, chronic bloating, chronic asthma or recurrent infection, or acquired asthma in later stages or later years. And then we have presentation of the immune system. Mostly people get sick easily despite them taking medication or frequently visiting the hospitals. We have people with neurological presentation, mostly from the CNS point of view. Get to see patients with stroke. We get to see patients with issues like developmental delays in children. We see patients with weakness, maybe on one side of the body or on both legs. Yeah, most. I would first say that fascia manipulation is different from a massage because one, there's no use of oil. If you look at our treatment methods, most of the time we don't use the oil. The reason is because when you're doing the manual release or the manual mobilization, we tend to mobilize very specific points in the body, and we use friction, deep friction, to generate heat to help release densifications. We usually call them densifications. These are the areas of adhesions that alters the nerve communication, resulting in pain. So fascia manipulation is very different from other manual methods because of its specificity in terms of points in the body that we release for treatments.
As compared to other therapies that they have tried.
Because with fascia manipulation, we tend to look at the body as a unit, an integrated unit that functions in unison. So for you to be able to release the presenting pain of the patient, even if it's just on a single segment, you have to look at the whole body. I think most of the manual approaches, they tend to segment the body, trying to fix where the pain is. But with fascia manipulation, when you look at the bigger picture, the interconnectedness of the body, you can be able to fix the patient with a single symptom or with multiple symptoms just by knowing how the body is interconnected. Mm-hmm. I think when it comes in management of complex presenting musculoskeletal pains, because when you look at how patients come to our clinic here, most of the time, they have more than one symptom. And when a patient has more than one symptom, it becomes really difficult to help them with their presentation if you're segmenting the body. But when you look at the fascial system and you try to look at the bigger picture of the body, you're able to fix many presenting symptoms in a single session, and you're able to help this patient, giving them a long-term relief for their complaint. So I'd say that if you're looking for a conservative method that will help your patients and give them a long-lasting relief, fascia manipulation would be the leading method. I mean, the best advanced conservative methods in pain management.